Hi, this is Sarah Mikesell with the Pig Site, and today we're here with Dr. Paul Sundberg. He is the Executive Director of the Swine Health Information Center. Thanks for being with us again, Paul.
Thanks for having me, Sarah.
Very good. Can you give us an update on African swine fever and what you're hearing about down in the Dominican Republic?
Sure. The Dominican Republic's got African swine fever the first time in 40 years that it's been identified in the Western Hemisphere. There's testing going on right now, testing and response. We've got to remember the Dominican Republic's an independent country, so USDA, United States, can't go down there and say, here's what you're going to do.
Right.
So it's a collaborative effort, and there is testing going on in the DR right now. USDA has offered help. They have a laboratory set up in the Dominican Republic that's helping with their testing so they can do quick monitoring and surveillance. The Dominican Republic is involved in depopulation of positive sites, so that's ongoing. There's work that's happening there, and USDA is helping to respond to that in every way they can. One of the things that is very important for us is what's going on in protection of Puerto Rico and making sure in every way possible that there's biocontainment on the island of Hispaniola. So it's not just the Dominican Republic, but it's also Haiti. I just got word this morning that Haiti has officially acknowledged ASF infection in the country now. And so it's on the island. We know it's on the island. We can expect that it's probably broadly spread on the island. There are multiple, more than half of the provinces in the Dominican Republic have tested positive. So that's not really a surprise. But there's assistance that's happening. And that assistance in diagnostics, that assistance is in control, in depopulation. One of the most important things to note is that when we talk about making sure that, okay, it's biocontainment on Hispaniola, we already have in place the preventive measures for ASF in the U.S. anyway. The ports of entry are inspected. The people coming into the ports of entry are inspected. The Customs and Border Protection does interdictions with people that are carrying sandwiches. Right. USDA does interdictions with illegal meat products. All of those kinds of things are going on. So we've already worked on mitigating the risks. The ASF in the Dominican Republic doesn't really change those risks, doesn't really change our mitigation. But what it does is probably puts more pressure on our borders because there's ASF right next to us now. And so that gives some more urgency. But USDA, in cooperating with the Dominican Republic and offering Haiti some supplies and some services, as well as offering the Caribbean and looking more broadly than the island of Hispaniola to offer Caribbean work together with the international organizations and those countries. It's all about containing that virus on the island and then trying to eliminate it from the island to decrease our risk.
Very good, and I think it would have been obvious, I guess, that Haiti probably had had a similar outbreak since they're connected. They're all on the same island.
Sure.
And so will they go through a similar process then as what the Dominican Republic has done? Is that your assumption, that there will start being more testing, more checking of not just wild boar but pig populations that are farms?
Yeah.
I guess.
Yeah, so I do know that Haiti has sent to Plum Island, to USDA on Plum Island, I don't remember how many hundreds of samples for them to test. There's a cooperative program. Haiti's asked for that assistance, and USDA has fully offered diagnostic assistance to the country. So those types of things are in process. It's going to be a long haul because first you've got to identify infections, you've got to depopulate it, you've got to try to clean it up, try to repopulate with negative pigs, keep them negative. Right. It's going to be a long haul on the island, but we're doing everything we can, along with Canada and other countries that are offering help to the island to help control and help respond to the infection.
Very good. And One other quick question too, you mentioned Puerto Rico. I mean, we've heard these discussions that if it would get on or be identified in Puerto Rico, that could affect all of the United States since they are a part of the United States.
Yep. So if it gets to Puerto Rico, the Chief Veterinary Officer of the United States is bound to notify OIE, the International Organization of Animal Health, that there's been an ASF infection on a U.S. territory. And so that does. But USDA has also put into place, or is putting into place through the OIE, through that international organization, what's called an application for a protection zone. And in a protection zone, it's an internationally recognized procedure that a country can say that this area of the country or territory is at imminent risk of infection. And here are the things that we are putting in place. It's negative, Puerto Rico is negative, but here are the things we're putting in place proactively. Should it become infective, we can quickly respond and react to it, so it shouldn't affect our negative status. And they're going to submit that to OIE. My understanding is that's not quite done yet, but when that happens, then the expectation is that our international partners, trading partners, will recognize that. And should it get to Puerto Rico, and again, I want to emphasize Puerto Rico is not positive, but should it get to Puerto Rico, there's already the background work in place that's done to be able to quickly respond and make sure that the mainland U.S. is protected.
So sort of like zones that we've seen in other countries, right? So that could kind of be its own zone.
Yeah.
It would be ASF positive, but mainland United States would be negative, and so hopefully. So usually what there is there's a control zones and there's free zones. Right.
In this case, it's a protection zone. It's neither controlled nor free. Well, it's free, but it's not controlled because there isn't an infection. But what we're doing is we're protecting our interests there. So should it become infected, then we can already demonstrate how we have quickly responded and already put into place all of the things to keep us negative.
Very good. Well, thank you so much for all this information, Paul.
Thanks for having me.
This is Sarah Mikesell with the Pig Site.